It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon Lapook and Dr. Herbert Lepor, Professor and Chairman of Urology at the New York University School of Medicine. First up, the Zika virus. 15 locally transmitted cases have been confirmed in the trendy Miami neighborhood of Wynwood, and fears are growing that Zika could spread rapidly from there. Florida Governor Rick Scott is pressuring the federal government to provide more resources, while the Centers for Disease Control are stepping up their efforts to combat the virus. So this week, the CDC has some new guidelines out. What do those guidelines say?
Yeah, and I think people should know where to find all that information, by the way. So just at the CDC website, just Google CDC space Zika. And then specifically, if you want pregnancy, space pregnancy. First of all, they said pregnant women should not travel to the area in question in Miami. Very unusual travel advisory within the United States, or to any place where there's any ongoing Zika transmission. They said that pregnant women who travel to this area on or after June 15th, 2016 should talk with the healthcare provider and should be tested for Zika. And women and men who travel to this area should wait at least 8 weeks before trying for a pregnancy. And men with symptoms of Zika should wait at least 6 months before trying for pregnancy. You remember that it's been found, the Zika virus has been found in the semen of men for up to 62 days after infection. And finally, all pregnant women in the United States should be assessed for possible Zika virus exposure during each prenatal care visit. I don't want there to be confusion. What that means is asking about symptoms, travel history, sexual exposure, and if the doctor thinks there's reason that there was exposure to Zika virus, then get tested.
Speaking of symptoms, though, John, I mean, the virus produces usually only mild symptoms, sometimes none at all. So what do you need to be aware of?
Yeah, that's the problem. 80% of people, it looks like, who have Zika don't have symptoms. But it's kind of viral-like symptoms, which is a headache, fever, rash, aches and pains, and conjunctivitis. You can get like a red eye. But any of these symptoms, and certainly if there was an area of travel, people need to tell their doctors.
Herb, how worried should we be that there's going to be a full-blown outbreak here?
Well, dengue fever is transmitted by the same mosquito as Zika. There are several outbreaks which were contained. So hopefully, our healthcare system and the government will respond effectively. So I'm optimistic, but this is an entirely different virus. So time will tell. I think we need to be on guard.
Response means funding. I mean, we've heard the president say there should be emergency funding. Congress is in recess. What happens?
What's happening is that every public health official at every level, federal, local, state, who I've spoken to, they are just beside themselves about this. President Obama requested $1.9 billion in funding back in February. Still not a penny of new funding. There's a lot of finger pointing in Congress, but the bottom line is...
What does a delay mean, though? If we're delaying, what does that mean?
What that is delaying is, think about it, this happened, we knew about it in our winter. We had all these months to get ahead of it, which would have meant preparing all these towns for local mosquito control, which is laborious. You saw David Begnaud's reports going house to house and trying to do spraying and teaching people to get rid of standing water. I was in Recife, Brazil, the epicenter, and the Army was doing that house to house. This is no easy task. You have to build up a lab facility. So the fact that Congress has not gotten it together to have some funding here, and now we're in the height of mosquito season and they're on vacation, you got to wonder what's going on.
All right, moving on. Biking has always been a popular form of exercise, especially in the summer months, but there could be an unwelcome side effect for men, erectile dysfunction. Herb, there's a real risk here involved when men cycle for extended periods of time?
Correct. So we know that male professional cyclists are prone to develop erectile dysfunction. So what's the culprit? It's typically those very narrow bicycle seats. They put pressure on the nerves and the arteries that mediate the erection. So what's the solution? Should you stop biking? Absolutely not. So first, if you get a seat, a broader seat, it will take some of the pressure off those arteries and nerves. Wear maybe shorts that are padded, that can be helpful. And in terms of if you're gonna take a long bike ride, take a breather. Both for you and the nerves and the arteries.
What do you describe as a long bike ride?
Oh, well, for me, it would be 10 minutes. But I would say for a cyclist, a recreational cyclist, probably, 2 or 3 hours. You're in the Tour de France, you can't rest.
That's a long bike ride.
But if you're a recreational cyclist, which hopefully they're listening, just take take a breather.
You still want to be a Tour de Force after the Tour de France.
Yes.
You got it.
You gotta take
I think some people.
You were saving that upwards.
Off and on the bicycle, right?
It seems as though there's some correlation, or at least people think there might be a correlation between erectile dysfunction and prostate cancer. Is there any truth to that?
Well, there was,
Drugs, I should say, yeah.
well, there really isn't in terms of epidemiologically, but there was an interesting study from the laboratory suggested that some of those drugs, such as Cialis and Viagra, that are used to treat erectile dysfunction in the laboratory, they actually slowed the growth of prostate cancer. So the question, might these drugs be effective as a way to either decrease the development of the disease or, in fact, the progression? But there was some disappointing news. There was a study. It was a large group of men who were on a prostate cancer prevention study. So they took those men, they looked at how many got the Viagra and Cialis and how many didn't. Again, this was a study looking at the development or the prevention of prostate cancer. No difference. So at least the laboratory suggested maybe there's another role for these drugs, but unfortunately the clinical data doesn't support it.
Well, finally from us this morning, trampoline risks. Trampoline parks, those indoor facilities covered wall to wall in trampolines, have seen a steady increase of injuries. A new study from the American Academy of Pediatrics shows that the estimated number of emergency room visits for trampoline parks increased from 581 in 2010 to nearly 7,000 in 2014. The most common injuries, no surprise, strains and fractures. That's why you sign those big waivers, isn't it?
Yeah, and I have to say I looked into this in some depth, and the American Academy of Pediatrics recommends against recreational trampoline use for children. And they say, though, if the people go ahead and use it, you have to have safety measures, including constant adult supervision, which may or may not help. They just must be watching the disaster. Adequate protective padding, one jumper at a time. They like to have like 7 at a time. And then avoiding flips or somersaults, which can cause devastating head and neck injuries.
That was a rule in our house, no more than 2 people on the trampoline. Doctors Jon Lapook and Herbert.
No more than 1.
Oh, come on.
Times have changed, Anthony. Get on board.
All right, and Dr. Herbert Lepor, thank you both very much for being with us this morning.